You are watching McLaren Report here on Today's Health, and I'm speaking with primary care physician Dr. Reid Stromberg about some common health issues that we're seeing in certain age groups and populations. Dr. Stromberg, in this segment, we're going to be talking about our Generation Z, but in really focusing on people maybe mid-teens, like maybe 13, 14, up to age 23. So what are the common things that you're seeing in this age group?
So there's quite a few of them. Usually we're looking for that their weight is normal, that they're getting frequent exercise if possible, that they're able to pay attention in school, not have any signs of attention deficit disorder, that their immunizations are up to date, including flu shots, tetanus shots. Gardasil would also be a catch-up vaccine at this age, and then more the 18-year-olds meningitis vaccine.
And so this is really how often do you see this age group? Is this maybe a once-a-year wellness check as well?
Yeah, typically we recommend a yearly well child check.
And I think when I think of this age group, I think of the kids that are maybe transitioning from a pediatrician then to a family practice office. Is that about the age that you start to see kids transition?
Yeah, frequently. We do see newborns as family physicians. 0 to 110 is common for us, but some people do start with a pediatrician and they stop seeing patients at 18. Now, I do have my associates that are internists that start seeing patients at 18. And of course our obstetrician gynecologists that see all women from 18 and on typically. Occasionally they'll see the younger women as well. And as a family doctor, I kind of fit between the pediatrician and the internist, kind of mashed together in our educational experience.
Very good. I think as a mom myself, and now my daughters are older, there's a time when you don't really need to go to the doctor as often. And I was even guilty of that myself. And then I think having that college-bound age student, how important it is for them to have a relationship then with their primary care doctor.
Yeah, very much so. I mean, we all live busy lives in this country, so sometimes it's not on the top of our mind, especially when we're healthy. A lot of times we'll see them for colds, flus, and joint pain issues. We'll remind them, hey, we'd really love to see you back for a well child check.
Yeah. So with this age group, are you seeing other conditions, maybe some issues with depression or anxiety?
So depression and anxiety is common through all the ages, but certainly it does typically start at this age. We see them for that. There are some medical reasons that people may or may not be treated if they're under 18 for depression. There's been some studies that shows increased risk of harming self because of their emotional immaturity. Unfortunately, people don't mature emotionally until about 26. So their emotions tend to be higher highs and lower lows in this age group.
So really important then to have that, someone you feel that you can talk to and have that relationship with a doctor to be able to address those very real and serious concerns.
Yeah, very much so. Typically, treatment for anxiety and depression can include medications, but studies have shown that counseling with a licensed counselor, psychologist, or psychiatrist is equal to medication. And if people need both, 1 and 1 does equal 3 in this case.
Very good. We talked a little bit about some vaccines that are important for this age group, and you mentioned Gardasil. So I wanted to talk about, for our females in this age group, when do you start doing like pap smears? And can you talk a little bit more about Gardasil?
Of course. Pap pelvic exams are typically at the onset of sexual activity. So if they're not sexually active, there's typically no risk for HPV, which is the cause of human papillomavirus and the cause of cervical cancer. In fact, Gardasil is the only vaccine preventable cancer that we know of.
Can you talk just a little bit about the counseling that you do with STDs in this age group then too?
Yeah, certainly. I mean, some people do start sexual activity at younger ages. We recommend that if you're sexually active and you're younger, that you be screened for sexually transmitted diseases at some point. A lot of times it can be done with a simple urine test.
Very good. And what are the other vaccines then that you look at the age group?
So meningitis A and B, that their tetanus boosters up to date. A yearly flu shot for everyone is always recommended.
Great. And the meningitis is really one that's come up for our college-bound age students. Is that correct?
Yes, 100%. Unfortunately, meningitis is a very fast-acting disease, and the vaccine could prevent that. Someone can be fine and 24 hours later be deceased.
Dr. Stromberg, thank you so much for sharing this information with our audience.
It's my pleasure. Thanks for having me.
And thank you for watching this episode of McLaren Port Huron Today's Health. If you would like more information or to schedule an appointment, go to our website at www.mclaren.org/PH Family Doctor. To watch additional videos, visit our website at mclaren.org/PH Videos. This is Kelly DiNardo reporting for McLaren Port Huron Today's Health.